Hi, my name is Dr. Ben Barton, and I want to welcome you to the docuseries, The Truth About ADHD. We're going to be discussing true ADHD. We're also going to be discussing what we call phantom ADHD, which walks, talks, and looks just like the real ADHD. However, it actually comes from a different condition. Today's episode is going to be covering neurofeedback. You're going to hear from Dr. Robert Turner, who's a world-renowned pediatric neurologist. Now, the concept of neurofeedback has been around for over 50 years. This is evidence-based therapy that has not been very widely available until recently. Your child can benefit from neurofeedback now at his doctor's office or even at home. And it looks like you're playing video games, but actually you're retraining the pathways in the brain to help better focus and decrease the symptoms of ADHD. The one big thing about neurofeedback is it can have a very quick and very profound change in your child's behavior and in their performance. Neurofeedback can also help treat the symptoms of ADHD and the symptoms of phantom ADHD, which are very similar but come from different conditions.
My name is Dr. Robert Turner, and I work as a pediatric neurologist, neuroscientist, and epileptologist. I've been in the field for almost 30 years, trained in multiple areas of neurology, pediatrics, developmental medicine, epilepsy, and neurophysiology. And I want to take some time today to impart some of the things that I've learned over these 30 years and many things that have changed the direction of my medical career the last 5 years, to be practicing as a true healthcare provider, to providing health and health restoration to patients and families. Many times when people come in, they come in with a specific diagnosis. And that's important for me to know, but what's more important for me is to get a thorough history and evaluation and look at what's going on with their brain function, because many times that reveals that the diagnosis is not correct. So we look at the symptoms and we use that term phantom ADHD. When people come to see us with a diagnosis of ADHD, whether that's real or not, they're experiencing symptoms. It's currently clearly understood, and has been a misnomer for a long time, that our brains really can't change. And many people haven't been told that there's any other options other than a chemical intervention for their symptoms of ADHD. Many people that come to see us are experiencing problems from the treatments they've been given, and much of the time that's because they don't have ADHD. They have this phenomenon of phantom ADHD. My experience so far has been, it seems about 50% of the time when somebody comes in with a diagnosis of ADHD, it's not pure ADHD. Frequently there's an anxiety basis, and anxiety doesn't always show up on the outside like we might think it would, but it shows up definitely when you can see it in the functional brain mapping. Neurofeedback has been around most of my life, and I was completely unaware of it. When I finally started looking into it seriously and looking at the evidence base behind it, our brains respond tremendously to feedback all the time. Everything we do is feedback. If I touch a hot stove, that's feedback saying, ouch, do not do that again. Our brains respond progressively with this feedback. Here, what we do is use something called brain mapping. We look at the brain function, find areas of the brain that are not well regulated, giving symptoms of sleep problems, anxiety, ADHD, things like that. And then use that information to help retrain the brain without putting anything in the brain and help restore that function, and we see symptoms begin to diminish and go away. And that frequently allows people to decrease and sometimes get off medications because the brain has taken over the functions that those medicines were trying to accommodate for. Neurofeedback is beneficial for people who would experience what we call phantom ADHD, because it's addressing what's going on at the brain level, whether that be anxiety or problems with inadequate sleep or metabolic problems, because we're going to the source of the problem, which is the brain, and not getting stuck in a diagnosis and therefore treating in a limited way. And so we're addressing the whole aspect of brain function. One of the reasons I started investigating seriously neurofeedback as a whole field, considering its long history, is the claims that were being made. To me, they were either true, and I had to figure out why in healthcare we have largely ignored that, or they were false, in which case I wanted to find out what's all the hype about it. The more I investigated this, the more I researched it, and then completely changed the paradigm of my practice over the last 4 years. We see changes in young children, children of all ages, and adults so far up into their 80s. Our experience, and I've used this term much over the last 5 years, is I'm seeing changes in patients that I have never seen in the first 25 years of my career, where we're restoring health, restoring function, and allowing children and adults as well to begin to reestablish healthy brain function and begin to decrease medication, to function and to decrease side effects that they not infrequently experience on medications. And many of the people that come to see us are already on multiple medications. I think of many stories that have blown me away. In the early time of the practice, we saw a lady in her early 80s that came in with lifelong anxiety, lifelong insomnia, difficulty sleeping, on quite a few medications. She came because she knew somebody who had already been here for neurofeedback and had experienced some significant benefits and improvements. She came, and she didn't tell me this till later, but after her first session of training, she experienced a noticeable decrease in her anxiety, to the fact that she thought it was a placebo. She thought it's all in her head, and didn't tell me for the first 9 or 10 sessions. And I agree, that's a pretty rapid response. And that persisted through the whole training and just got better, and she was able to wean off medications. And again, things I have never seen before in my career. Our brain can change and improve at any age. We all understand intuitively that when we want our bodies to become healthier, we can go to the gym, we can make changes, we can train. Our brain is, I think, almost infinitely more capable of responding to training to improve. That's not a new concept, but it's a pretty foreign concept in healthcare today. We've been conditioned that our brains are what they are. If you have to go on a medicine, this is what you're going to take for the rest of your life. That's kind of all you can do. And that's absolutely counterintuitive to the way our brains are made. There's a currently very well understood concept that we've probably intuitively known about for centuries, but that's called neuroplasticity. I summarize that as our brains have the lifelong ability to change, to grow, and to heal throughout our lives. The message we want to give to people is it's never too late, because frequently when people come here, they're hopeless. They're tired, they've been on multiple medications, they've experienced significant side effects, and they're tired. This principle of neuroplasticity means our brains are plastic. They have the ability to change. Much the way our bodies change, if we change our lifestyle, we exercise, our bodies can get healthier. Our brains even more so. And by doing that repetitively through a training process like neurofeedback, it builds and builds and builds and improves to the point eventually where the brain will restore functions that weren't working well before, and they are self-sustained after that point, often without medication that was required before to maintain function. We know now, and we can demonstrate it with clinical studies, when learning to play an instrument, practice changes our brain. Our brains have the ability to change, called neuroplasticity. The more we practice, we get self-correction. If we have an instructor, when we make a mistake, we hear that, we see that, we gradually correct that. We don't give up the process and say, I'll never learn to play an instrument. It takes time. And over time, as we get better and better with learning an instrument, the same way neurofeedback improves over time. The ability of the brain to build new pathways. Learning to play an instrument works because it operates on the principles of neuroplasticity. By doing these repetitive activities, whatever the instrument, our brain learns and improves how to play. Really, from the beginning of time, we've understood that our brains can learn and grow without medications. That's the whole process of education. And that can extend not only to learning new information, but relearning how to think, relearning how to program these pathways that aren't functioning in healthy ways. There's a phrase that's been used for some time, neurons that fire together, wire together. When we do the same repetitive training actions, we grow, modify new, healthier connections. When I'm talking with patients and families, I frequently use the term or the concept that medications, they can be very beneficial. They can help, they can save lives, but they're Band-Aids. They're not changing for the better what's going on at the level of the brain. Sometimes they're having adverse, harmful effects, but they're not helping. They really are a Band-Aid. The analogy I make, it's frequently acetaminophen for the fever without trying to figure out what's causing the fever. We might get the fever down, but we need to get to the source of the problem. Neurofeedback goes beyond this because it's not just trying to suppress a symptom, it's getting at the root of what's going on at the brain level to help rewire, restore function, and repair and heal the brain. And then when that happens, the symptoms that somebody's been experiencing that have been troubling them diminish and go away because the brain has learned how to take over what it was struggling with before. Throughout the duration of medical training from the Hippocratic Oath, we've been taught, first do no harm. And it just seems intuitive and natural for me as a physician and a healthcare provider to offer families the thing first that's the least invasive, that's not going to harm them, that has a tremendous amount of evidence-based medicine behind it. And those things include neurofeedback, heart rate variability training, and biofeedback. By using neurofeedback in our clinical practice, what I see more and more is people begin to experience relief of symptoms that they may have experienced for months or years. Often some of the easiest or quickest symptoms to respond are problems with sleep and problems with anxiety. And frequently after that, problems with paying attention, sitting still, hyperactivity. Heart rate variability sounds like a complex concept. Basically, when our heart beats, if we say our heartbeat is 60 beats a minute, it is not every second exactly. There's always a very small amount of variability from beat to beat. That's called heart rate variability. The more variability there is from beat to beat is a sign of a healthy cardiovascular system. The amazing thing about that is that the more uniform the heartbeat becomes, the less variability, the more that correlates with disease states, with ill health. The only time we have no heart rate variability is either when we have a pacemaker or just before we die. So variability is a healthy, a flexible thing that implies health. The amazing thing is the incredible connections between the brain and the cardiovascular system, as well as the brain and the gastro-GI system. And so when heart rate variability, which can be trained to become more healthy, when that's done, it has a wide variety of health benefits. So many mimickers of ADHD, phantom ADHD, ADHD, anxiety, sleep, depression, PTSD can improve by training heart rate variability. Heart rate variability training is something you can do now. You can do today, you can do tonight, and you can do every day with no investment of cost. You can find apps on your phone. It's easy to learn. It takes a very small amount of time every day, and it has widespread benefits on our health. We've covered a lot of information today and in this series, and that can be overwhelming. But information and knowledge is extremely valuable, and one of my goals is to help people be empowered to be more knowledgeable in their healthcare decisions. So I want to provide some actionable information, things you can do today and tomorrow. Ask questions. Everybody's entitled to ask questions. And one of those questions can be, why am I experiencing the symptoms? I understand you might want to prescribe a medicine for my symptoms, but first help me understand why those symptoms are occurring. I understand a chemical solution might help diminish the symptoms, but it doesn't get to the root of what's going on. If those questions can't be answered, find a healthcare provider that can answer those questions and ask for a referral to someone who can answer those questions. Why am I experiencing the symptoms, the problems that I'm having? An analogy that I make is typically a person doesn't go see a cardiologist who doesn't test the heart. And many of the symptoms we experience are based out of the brain. Why wouldn't we be testing the very organ that's behind those symptoms? Another thing is to look into companies that provide heart rate variability biofeedback devices. They are inexpensive and effective. Another very simple tool to use is learning how to breathe correctly. Frequently that's called diaphragmatic or abdominal breathing, which helps exercise more of what's called the parasympathetic system. And we all have comfortable rates that calm us down, usually about 6 breaths a minute. It varies from person to person, but using simple tools that you can learn today can have huge impacts in changing our entire bodies. I find it perplexing sometimes that we seem to understand if I'm going to stay healthy, if a person stays healthy, they're going to go to the gym or work out every day or several times a week. And we know we're going to do that the rest of our lives. But we don't incorporate the concept of exercising or training our brains. And when we do begin to implement things in our lives that train our brain to more healthy states and do that over the long haul, there's no telling what kind of changes we will experience.